Hi everyone, how we doing? Dr. Rob Kiltz, See My Fertility, and welcome another live Facebook, and really excited to share some ideas and your questions. We've got some already in, and Will's really helping us with that. Reconnect, all right? Checking to make sure we're on live. And just bear with us a minute while we make sure we're all connected and sound is good. Just to make sure that I get live here. There we go. All right. And welcome everyone. And let's lower my sound and make sure I'm muted here. And we're going to do shout outs and likes and please everyone. We're really so appreciative that this connection in the nation and globally, and really it's a village and family to help build families. And this fertility journey is really, really hard. Emotionally, physically, financially, for so many out there. And really one of the things that we've been working so hard to do is make it more affordable, but dip into this huge bucket of ideas of Eastern and Western medicine and try to learn together. And so much of what I've learned over these last 20, 30 years of doing this is that our patients, you guys, bring us so many new ideas. And we're going to meetings and reading the journals and really tapping into all of it together. So again, we're really appreciative, and a shout out to all here. Hi, Teresa, Yulisa, Jacqueline, everyone. And we got a few questions that have already come through. Will's put them together, and I'm going to start a little bit why CNY Fertility really focuses on affordability. And really the biggest thing is that's been our mission since the day I started CNY Fertility over 20 years ago. Is why should it be so expensive? It shouldn't. And we've worked on payment plans and really, in those in need, please send it our way. And Sandy has a question about Humira and Plaquenil and other meds that may be taken. And these are all part of what I call the immune protocol. And if you haven't read a little bit about our story, and a lot of what I believe in is that inflammation in our bodies is the cause of all diseases, and fertility obviously is the one we're dealing with. And just like arthritis or irritable bowel disorders or so many other immune problems, treatments are with Humira, Plaquenil, IVIG, with steroids, with aspirin. Prograf, tacrolimus, is a medication used to prevent organ transplant rejection. And an embryo is simply an organ attempting to transplant in the woman's womb. And so it's really become very interesting. And if you really begin to delve into the research out there, and there's some really good stuff. And if you look at Alan Beer's stuff and Kwok Kim's stuff, Dr. KK, there's really much out there, and there's some really good journals on reproductive immunology that I think is so helpful in this process. It's something that most of us in this area of reproductive medicine don't look at, but as a reproductive endocrinologist, a fertility specialist, and a reproductive immunologist, I think it is really the home run that we need to be looking at. One of the interesting parts to this whole story is how can what we put in our body in the way of air, water, food, and then our environment, how stress significantly affects our cortisol levels, our epinephrine levels, our serotonin and oxytocin levels. And these are really important to modify and modulate. And I talk a lot about not doing fight or flight exercises. Fight or flight exercises really affect the muscles, the joints. They heat up the body, and cortisol and epinephrine, which is pro-inflammation. So what do? You slow it down. Yoga, massage, acupuncture, Tai Chi, Go for a walk with your partner. If you're going to go for a bike ride, go slow and easy. Get off the gerbil wheel, the treadmill. It's really not good for our systems. And we're going to talk a little bit more about ketogenic diet and why food is so important. Most of us have been taught that it doesn't matter, but in fact, it's probably the most important thing. And we've been working with Maria Emmerich, and look at mariamindbodyhealth.com, and she's got so many great recipes. And I know that I am very narrow on the diet that I recommend, but I'm being a little more extreme and just testing out some new ideas. But if you look at Maria Emmerich's book on ketogenic adaptation, you'll get a lot of really, really great ideas in the whole process. The ketogenic diet is about high fat, low carbs, no sugar, and the high fat suppresses inflammation, and butter fat, beef fat, pork fat, really important, cream, all of those things really, really, really help a tremendous amount. And so read her stuff and look at that. I think you'll get some good information on that. And Kelly, husband, and I have not been able to try it yet because we just cannot afford it. I've been doing keto since January, lost 17 pounds, and feel so much better. And I highly recommend men and women do this. And we've seen so many natural conceptions from the diet alone. And remember, begin to think, I can afford to do this, and begin to put a little bit away each day, $10 to $20 away, even $5 away each day, may get you to that thing you thought you couldn't afford. And I really, really recommend reading The Secret by Rhonda Byrne, The Alchemist by Paulo Coelho, and look at things like imagining the dream that you desire as if it's already here. Vision boarding is another kind of interesting idea that most of us don't talk about in reproductive medicine. Let's see, Margaret asked a little bit about our immune protocol and whether it's on our page. It's in our magazine. We talk about it a lot. It's in our blogs. And it's interesting that most of the reproductive endocrinologists out there don't believe in the immune protocols and don't believe the immune system affects fertility. But I've been convinced after years of thinking no way, and then seeing patients that went on the diet or used the immune protocols like intralipids or IVIG, they got success. Hello, Alexandrina. Always a pleasure. And we're learning on this journey. Is it okay, Zara, okay to buy medications from online pharmacies as they are cheaper? Well, I can't tell you the right place to get the medications, but in my experience, these medications are made around the world. They're the same medications. We see patients from around the world utilizing these meds. So I have to believe that they're as good as any place else. Jennifer, priming. Talk about priming for IVF and how long and what does it take. So much of the ideas that we talk about is how to change the internal metabolism, physiology, and modulate the immune system. And we talked a lot about a 30-day prime. Now we're doing a 60 and a 90-day prime. The idea is that it may take 3 months before the egg and sperm goes through its development and the processes to get it to be a mature or near maturing egg or sperm. Now remember, women are born with all those eggs, but they're still going through some maturation processes within 30, 60, 90 days before they're ready to be recruited. But I always start with the brain, meditation, prayer, slow it down. What you put in the mouth, that's where keto comes in. I call it the Dr. Kiltz's Keto Cure, K2C, also the baby diet, BEBB, bacon, eggs, butter, beef. But look at Maria Emmerich's stuff, great on keto. It's a great start for 30, 60, 90 days. Additionally, we've been using low-dose naltrexone, LDN. Check it out. Read the LDN book. I've been fascinated. One of my patients shared this with me a number of years ago and helped me. It may have been Alexandrina because I've learned so much from Alexandrina. And again, so many of you, so keep it coming. But low-dose naltrexone is opiate agonist antagonist, and it somehow reduces inflammation in the body. I don't know how or why. Phil Boyle in Ireland, family practice generalist, has been doing fertility for years, non-IVF, but using this and getting some really great results. I think it's really helpful for those that have polycystic ovarian syndrome or metabolic syndrome, which ultimately is high glucose, and it's because we consume a high carbohydrate diet. In the fruits, fiber, vegetables, salad, Brussels sprouts, broccoli, asparagus, all sugar. And mostly we don't eat fat. And some of the other things we've been recommending are ovasitol or inositol. And the ovasitol is through Theralogics. It lowers insulin glucose levels, which is another culprit of the inflammation in the belly bucket. So I call the belly bucket, remember the bucket that we feed all the food into, which ferments alcohol, aldehyde, methane gas, and heat, bad for your eggs and your sperm, bad for your uterus and tubes, bad for all of us. And by doing that for 30, 60, 90 days, and I've seen it work in only a few weeks, but the more time you give it, the better you're going to be able to up your AMH, your ovarian function and reserve. You're going to improve sperm motility, count, and morphology. So the DNA fragmentation that occurs due to glycation, look it up, glucose binds and damages all of our cells, and we're seeing it in our fertility. And so it really is important to focus on keto, LDN. I've been, again, the ovasitol. The Ovavite is really good because it has the ubiquinol, and it has the vitamin D, and really important for those that have diminished ovarian function, DOR as it might be called, is some DHEA, 75 milligrams a day. So those are all some starters: acupuncture, massage, and slow it down. So I hope I've answered that. Thoughts on acupuncture by Sarah. Thank you very much. And most of this ancient medical practices like acupuncture and meditation and prayer, light therapy, herbal medicine, we don't know how they work. I believe it's the practitioner interaction with the patient really, really valuable and helps tremendously. And so whether you have it weekly, monthly, I think you'll find it very helpful. I used to have used it for stress reduction. Yeah, can you believe stress in my life? I know. And so it really is important. Seek out an acupuncturist that has some experience dealing with fertility. Some look for a certification. I think it's really looking for someone that's knowledgeable and has experience. And talk to them and get their best advice because they have gone to school as an acupuncturist and traditional Chinese medical practitioners. And Stephanie down 80 on keto, and really so many of us are healing. And personally, diabetes, hypertension, high cholesterol, everything gone. And we might not need doctors one day. I think that's not likely to change for a while, but check out Dr. Rob Kiltz's ice cream recipe and the steak recipe. Really, really important. Let's see. Melissa, your thoughts on nutritional response testing. I'm not sure I know what that is. Now you gave me something to look at. I think it's probably real important to measure some of your vitamin levels. Look at hemoglobin A1C, look at glucose levels, fasting. Cholesterol levels, I personally don't think they're as valuable as people think they are. High cholesterol is caused by a high carbohydrate diet. I think it'd probably be very interesting to look more and more at food allergy testing, because I think the other thing we're all missing is that we're likely allergic to so much food we put in our bodies. And if you find that thing, get rid of it. This is why the complex carbs and the excessive seeds, nuts, fruits, fiber, vegetables are likely contributing to a significant amount of plant antigens that we're allergic to. We don't know it until some disease shows up, but it's really happening below the surface for so long in all of us. I call most fruits and vegetables nature's toilet paper because it contains piss and poop and viruses, bacteria, yeast, so much that doesn't belong in our body. If you cook it really well, micronize it in so many ways, simplify it, and add cream and butter, that's where you get the real hit and beauty to that. Mara, thoughts on AMH? It's 18, wow. Have done 18 medicated cycles, 5 cycles, those IUI, no success. I have secondary infertility for the last 7 years. Well, high AMH indicates metabolic syndrome, PCOS. And this is where keto is likely the home run. I work a lot with ovarian drilling or acupuncture. So that's a laparoscopy, put little holes in the ovary. That seems to help some respond that aren't getting the response to the standard medications with a high AMH. But low-dose naltrexone, the Ovasitol, Ovavite, and really you have to go ultra keto. I recommend 1 meal a day before you go to bed or 12 hours apart. So the idea is by reducing the amount of food and carbs in the gut that's fermenting, plus all the plant antigens that we're allergic to, and the high glucose, which is basically glycation, you'll really help reduce the inflammation in your body, in your gut, which is affecting your ovaries. Remember, the belly bucket and the ovaries and uterus are just covered by the bowel that's secreting all of this inflammatory reactions, and it's 5 to 15 degrees higher than the rest of the body. So your body's constantly trying to get rid of the heat, but it can't. The ovaries, the testicles, the uterus are getting damaged. It's just really a phenomenal story as you begin to make more sense of it. And most of us Western trained doctors just cannot. Hot tubs, bad. Cool soaks, probably better for most of us. And so the priming, by the way, whether you're doing natural, IUI, IVF, even if you're doing embryo transfer, frozens, or donor eggs, really important to prep and prime the body 30, 60, 90 days. That's going to be real important. And I've seen so many women in their 40s not get pregnant, poor response with IVF, do the diet, natural pregnancy. So don't give up. Always consider that. And you know, one of the interesting things I've seen is that the laparoscopy and hysteroscopy are just like pushed aside and never looked at. But the number one symptom of endometriosis is infertility and repetitive pregnancy loss. So it's something that should be looked at in either laparoscopically. Sometimes it can be seen with ultrasound. There may be some testing with endometrial biopsy that may help with that, but ultimately you got to look inside. You're either going to treat it with the vaporization of the superficial, excision of the deeper, and or Depo-Lupron for 1, 2, or 3 months. And this is really something that most of us miss. Gee, I'm getting pregnant but miscarrying, or I'm not getting pregnant. I have no pain, no other symptoms. It's endometriosis or intra-abdominal pelvic inflammation. Guess what? It's what we put in here way too much. And slow it down, as I've said. And Bonnie mentioned about the keto group. So listen, there's so many ways to do this. It's a wide expanse. And the more and more we all group together and talk about it, we all learn and share. And I really appreciate the feedback. If something's not feeling right, is wrong, send it back my way, by the way. And hang on 1 second, I've got to tap in a little energy on the iPhone. This new iPhone's supposed to last longer than they say, but we're connected now. And Amanda, the girls will share the keto group. Bonnie, let's just make sure it's all shared out there, and we'll get more information. Natalie, 50 pounds in 3 months, rock on. And it is pretty amazing. Let me keep going. Endometriosis and tubal scarring. Laparoscopy stage 4, 9 centimeter endometrioma. And let's see. And keto will help with all of this, by the way. But removing the endo, I think, is real important. Removing the scar tissue, cleaning it out, will give a fresh start to the environment. And whether you do the Lupron or not, but I think that the LDN, the Ovasitol, the Ovite, and keto is critical. Tiffany, how are you doing? Egg quality. All right, so to improve the eggs, one is you have to eat fat, real fat. I'm beginning to believe that olive oil, avocado fat, and coconut oil may not be as good as beef fat, pork fat, butter, and cream. But the coconut oil may be the thing, but of the top 8 allergic foods, coconuts are in there, so be really careful with that. But the DHEA, the Ovasitol, the LDN, and keto, and acupuncture, and slow it down, cool it down, really is a home run in helping improve them. And Maya massage, so abdominal pelvic massage and acupuncture can really, really, really be helpful. And, you know, get rid of the news, get rid of all the gossipy, negative stuff, put in the positives, listen to a great podcast. And the CNY Fertility website has some really great meditations. Download them, enjoy them. Really helpful in building what goes on in the brain, faith. Remember, faith and food equal fertility. So don't give up. Let's see. I had a successful 3-day fresh. And what would you recommend to prepare for someone with a low AMH of 0.43, 0.7? Lost lots of weight since the last time, and my FSH is good. Age is 38. Worried about egg quality now that I'm getting older. Well, we are all getting older. That's the good news. And really, it starts with the things we've talked about. Put it in here and have belief. Keto. Some people will do paleo, but keto really takes us to the next level. And then the DHEA, the Ovasitol, the LDN, the acupuncture. But the bucket that you fill in the belly, is it a bad belly bucket or is it a beautiful, positive, healing belly? And that's where that diet comes in. And I've seen AMHs go up. Additionally, human growth hormone. So I forgot to talk about that a little bit in the priming. 30, 60, 90 days of human growth hormone may help for the egg quality. But we're beginning to experiment that it may actually help for the guys. And so between Clomid for the guys, HCG for the guys, the LDN for the guys, the keto for the guys, and the human growth hormone may be something also to help. And then we often will use a combination of the human growth hormone, a gonadotropin like Gonalef or Follistim, with some Menopur, or adding the low-dose HCG to the mix in order to prepare the eggs. And then I typically am recommending a freeze-all cycle to then coordinate the improvement of the implantation site for embryo transfer. So that's something, Jennifer, I hope that was helpful. And a couple years off, but we'll be back to see us again. And, you know, I ran into a couple recently at Century Club in Syracuse. Great food, by the way. And one couple simply gave up and had 4 kids after that. And I know sometimes I always say, give it up. Give it up to your faith. That's something, it's a medical treatment. It's something been around forever. We should all be tapping into our positive attitudes, faith and belief in a higher power, spirit, God, nature, whatever it is. But it really is helpful and powerful for all of us. Joanne, hi, how are you doing? Keto 3.5 weeks, 15 pounds. Husband, you can do it. Remember, we're all lions here. And high cholesterol is caused by a plant-based diet. The liver's number one function is to convert all carbohydrates, all protein to fat. And so most of the doctors don't believe this. And if you read Gary Taub's book, Good Calories, Bad Calories, Why We Get Fat and the Case Against Sugar, you'll learn that high cholesterol is caused by the standard American diet, high carbs, low fat. And Jimmy Moore has a couple of really great books, Keto Clarity and Cholesterol Clarity. And Grace, really a pleasure, thanks. And Becky, always a pleasure, and thank you to all for sharing. But guys, I call this the Lion King plan. We're Ferraris, we're not Yugos. When you want to feed yourself like a lion, not a pig or a cow. And as a vegetarian, there are ways to do this, but the home run for this one is like a lion. That's really the key. I hope that's helped. And if you read those books by Jimmy Moore, Jason Fung, Maria Emmerich, and Gary Taubes, it's really the most important part to this. And Karina, how are you doing? Thanks for your question. How do I know my issue is inflammation? Inflammation is it. It's the number one cause for all of us in every single disease. If you're not conceiving naturally, your sperm is bad, your egg is bad, your AMH is bad, it's inflammation. And so the one way to lower and improve your inflammatory system is change your diet. Slow it down. Look at low-dose naltrexone. Unfortunately, so there are a lot of tests, natural killer cells, Th1, Th2 levels. You could look at hemoglobin A1C. There's some other testing for chronic inflammation. But ultimately, I believe it's a clinical diagnosis. And so it is really an important thing to look at. We can't forget that. Thyroid antibodies, anti-nuclear antibodies, antiphospholipid antibodies. We can measure all these things, but I'm always concerned that everyone is spending so much money on the testing, they now don't have anything for the treatment. And I think the treatment is the real home run. So just have faith in the opposite approaches to all this. Let's see. So husband has no sperm motility. Very discouraged. Well, one is keto for the guys is king. LDN. Look at possibly adding Clomid and HCG. Stay away from tobacco, hot tubs, marijuana, alcohol. Alcohol is a killer for all of us. Recently saw an article that suggested that 1 glass of wine a day will help us live longer and be smarter. That doesn't sound really like it makes clinical sense to me. So really look at a different approach to fixing the sperm. And also for the guys, look at varicoceles. And varicoceles can contribute to that. And also look at acupuncture, massage, and the same things that the women are looking at. And for some guys without motility, a testicular sperm aspiration may get better quality sperm that allows IVF with ICSI and injecting sperm directly into the egg. So that's another option there. But I'd be glad to talk and share my ideas personally if you like. Hi Tracy, how you doing? Asked about the donor egg program. Basically, we're out there looking for young women, 20 to 30, who are interested in helping others have children. We do pay $4,000 per collection, but we're looking for more and more women that are willing to just donate, just like blood and other organs, make it more affordable. You can bring in your own donor. We're either collecting these eggs and creating embryos and freezing them, or doing a fresh transfer, or collecting the eggs and freezing them and using frozen eggs. And all of these options work very readily. And it really is a matter of finding the right donor, preparing your body properly, and making sure that your body is ready for this process. Hysterosalpingogram, saline sonogram, and a sperm count, and just making sure metabolically and physically you're in good shape. Always recommend check that vitamin D, and check to make sure that your glucose and insulin metabolism is rock on. And the only way to do it for all of us is go keto, and Kiltz's Keto Cure. We're coming out with a book later this year and talk more about it, but really the blogs are out there. There's so much information out there. Zara, how you doing? What is the ideal time to get PGD done? Now, I think we're talking about PGS, which is the screening of an embryo for chromosomal rearrangement abnormalities. And really, my general belief is that if you have a known chromosomal abnormality, so it's real important to check karyotype on both the male and the female. And with that then, if there are no abnormalities, generally I'm not recommending it. I'm recommending more focus on the immune side. But if you have a lot of embryos, doing the PGS may help you select the better embryos for implantation. We're finding more and more that some abnormal tests may be falsely abnormal. There may be normal embryos there. And conversely, that a normal test may still be an abnormal embryo. But the PGD is used for those that have a known genetic disorder, cystic fibrosis, or other familial defects. But it's something that if you're failing, lots of embryos, it's a reasonable next step to look at in the process. We're using Good Start and Cooper Genetics at this time. And Good Start, we have a really good price on it, $300 per embryo for testing, which includes the gender, the biopsy, and also the chromosome assessment. Cooper, how you doing? See you out in Buffalo, and really Buffalo, Syracuse, Rochester, Albany, but really it's amazing how we're caring for people around the globe, and here to help in every way we can. Hi Jessica, how you doing? Diagnosed with premature ovarian failure, FSH of 45, a low AMH of less than 1, type 1 diabetes, and Hashimoto's. Is there any hope of using my own eggs? Well, interesting. So the cause of diabetes, Hashimoto's, and ovarian dysfunction and failure may be all related to inflammation, glycation, fermentation in the gut, and all these plant antigens that affect this. And I've seen those that have premature ovarian failure suddenly go out of failure, ovulate, and get pregnant. Number one is keto, keto, keto. It's really, really amazing. And if you didn't know this, diabetics used to be treated with keto diet, and they didn't, because they didn't have insulin. And if you read more about it, basically our bodies require zero carbohydrates. My sister Maria, who passed away a few years ago from diabetes, had it since she was 4, died in her 50s, had children, and I know that the diet that was recommended by the medical profession likely caused her disease and caused many of her illnesses through the years. So we see people from around the globe. Be glad to help even remotely. You don't have to come here to get this advice. We really want to give you advice to help you get pregnant naturally. If it's not working that way, either assisted reproduction or looking towards donor eggs or adoption. But while you're waiting for donor eggs or donor embryos or adoption, why not do everything you can to improve what's going on in your body, to hopefully help it work more naturally? Intermittent feasting, fasting helps also, and you'll need a lot less insulin for this. But again, it's really, really, really a whole opposite approach to this. Hey, Emily, how are you guys doing? And Courtney, too. You never know. And always have faith in the process give it up to the good Lord in one way or another. And Melody, thoughts on transferring more than one embryo? If you want twins, everything with my HSG was normal, perfect, and my husband's sperm is, seems to be the thing that's causing the infertility. So more and more, one embryo, one embryo, one embryo, one and done is what we're really working towards. More and more of us are really working to reduce. If the age is appropriate, the embryo quality is not as good, then placing two may be reasonable. But the risk of twins is far greater than most of us really want to put you or those children in jeopardy. But we could talk more about that on a personal level. Chastity, how you doing? Ovasitol and metformin together. You can. Ovasitol may be better. The inositol, inositol D, may be better than the metformin. I think it's better tolerated than metformin, so it's something to look at and consider. Low egg reserve, 41. Well, not just keto. Start with keto, intermittent feasting, fasting, massage, acupuncture, faith, DHEA, LDN, all of these things come into play in helping the process and improve the eggs. And don't forget laparoscopy, hysteroscopy. Look for endometriosis. You have to go laparoscopically look inside. It's not one that's easily diagnosed from the outside. How we doing? Time-wise, we're good. And Melanie, all right, we talked about that. Jessica, Cara, how you doing? Recommend PGS testing for over 40. I'm not a big recommender of it. Every embryo, given an option to become a baby, only can get it in a uterus. The testing may not be as accurate, especially in the 40 or over. Look at Gleischer's stuff from Center of Human Reproduction. But more and more people are transferring abnormal embryos and getting normal babies. But when all this is failing, it may be something to look at, and we're all for it, by the way. I wish we were closer also, Kelly. We're here. We'll help you whether you come to us physically or not. So much can be helped by simply having the conversation. It really is a short journey, believe it or not, and so many people are making the journey and getting the success in a more affordable option. But remember, there are great docs out there providing great care all over this world. Spencer, great question about keto and gout. Well, my opinion is gout is caused by plant inflammation, antigens, and glycation. It's not caused by fatty red meat. I think they're wrong. And so, like anything else, if what you're doing isn't working and it's drugs are the only thing, change the diet. Marie Emmerich, Gary Taubes, Jason Fung, it's so much out there on ketogenic adaptation. Look at Diet Doctor. Hey Amanda, how you doing? Look at dietdoctor.com. Andres Ienfeld from Sweden, really learned so much from him. Highly recommend. Join their internal group, a little bit of extra, but you get some extra advice. Great videos and things. Our body only works on fat, and fat is fit, and fat doesn't cause any diseases. And someone said to me recently, fat people get sick, they get skinny, skinny people get sick, they die. Now, that's not to say skinny is bad, but you have to have the fat. That's the fittest stuff for fertility. We've seen it more and more and more and more, but it really does. It works. We're just sending it out viral. Get rid of the drugs, get rid of the pain, the problems, energize in your life. And I know for myself, almost 62, and I do this crazy diet, but I call it the Live It Plan, and it's like a lion, not like a pig. Try it out and see what you do. And Kelly, thoughts on psychology differences? Partner doesn't want to conceive. Well, this is where you need to work together, share your thoughts and ideas, talk to a therapist, and just keep on holding on together. And one way or another, you'll find the right path. But you need to talk about it. And this is where I think therapy and support group can be really helpful. Kylie, how you doing? Recommendations better our chances for IUI. Well, our job is to better your chances with sex. Remember, you got to have sex. And if it's not sex, IUI. If it's donor sperm, still have sex, by the way. It really helps improve your odds. And if you haven't done a laparoscopy, look for endo. Hysteroscopy, D&C scratch may also help with natural fertility and with IUI. So don't forget it. It's something we've been using for a while now. You do a laparoscopy, hysteroscopy, and then someone gets pregnant. And why? I don't know. If you're going to wait for the answer why, you're going to wait a long time. Our job here is to inspire you to do something. And if what you're doing isn't working, guess what? Do something different. Really, really, really important. And listen, whether it's infertility or hypertension or diabetes or gout or other disorders, irritable bowel, whatever it is, this stuff we're talking about between meditation, yoga, acupuncture, keto, LDN, it helps for all of us. Let's see, both on keto, healthy, not overweight, vitamins every day, PCOS, remember, metabolic disorder. And it may take a more drastic change in the physiology of the food you're eating. And remember, overweight, the view of weight and its effect on health and wellness, I think is improperly quantitative. And it turns out that many thin people have many diseases and heavy people don't. It turns out that it's the food, the amounts, the beer, the alcohol, the fermentation. And I'm not a believer in probiotics at all. I think they're pro-bad for us. Get rid of the fruits, fiber, vegetables, and look at these ideas. Again, Maria Emmerich, great recipes. Touch base with her. She does some private consultations also. And we're working with Maria for some more recipes and joining and doing a book together. So we're really, really excited about that. But guys, gals, all of us together, whether you're in a same-sex relationship or you're single, really, this is important for all of us to latch onto. And if it's, when we say I'm healthy, I always say if you have a medical problem, you're probably not as healthy as you think you are. And we may look and feel it, but there's so many things that we can do to improve our metabolism and physiology and our immune system. So look at that. And Shelley asked about recurrent miscarriage. So repetitive miscarriage, more than two. Personally, I believe it's, if you have one miscarriage, you should be looking at what's going on in your body. What's going on with the sperm, the egg, the embryo, the uterus, the belly, the bowels, the whole body. Look at some of the immune markers. Look at your thyroid function. Really important. That thyroid is always going out of whack, and it's one of the first things to go out of whack when the immune system is out of whack. And so for recurrent pregnancy loss, we really talk about standard fertility evaluation and treatment. Are your tubes open? Is your uterus normal? Do you have endometriosis? Are you on the proper diet? Are there any other signs of inflammation? Do you have any food allergies? What's your AMH? What's your FSH? Look at fasting glucose. The guys, much the same thing. Look at semen analysis, morphology. Look at your male hormones. Do you have a low testosterone? The immune system attacks the testicular cells that make testosterone. It attacks all the hormone cells of the body, and it may just render the testosterone in your bloodstream dysfunctional because of glycation. And this, to me, is the most important thing. And this is why Dr. Kiltz is talking about food, because it's the fittest way, and fat is fit. It's really amazing. Ubiquinol gives me chest pain every time I take it. I'm not sure why that would be, by the way. Maybe try the Ovasitol. Maybe try it at night or the morning. If you're having chest pain, you should probably see a doctor. I'm sure you're talking about indigestion, but maybe that's related to fermentation and the other things going on in your gut. So take a look at that. I think it's real important. And again, share. It's just really important that we're all sharing in this process, so we're all learning. And again, I'm always looking for some new ideas out there. Is keto safe for type 2 diabetics? Well, guess what? You do keto, type 2 diabetes goes away. Listen, our bodies require 0 carbohydrates. Why are we eating them? Remember, your body requires fat and it requires a little bit of protein. So everyone's saying scary things about keto, but it is the cure-all. Again, it's the keto term is mislabeled, I think. We don't burn glucose and then switch over to fat. We burn fat always. So much of us have it completely wrong. And so I've seen so many of my patients, diabetes gone, hypertension gone, high cholesterol gone, and you're using the fat as fuel, and guess what? You get leaner and stronger. And get off the treadmill, by the way. And Bree, how you doing? Canada, mid-40s, young, have a baby, own eggs, and sperm donor doing IVF. Absolutely. Remember, keto, LDN, DHEA, those are the first things to do. Maybe a 1 to 3 months of human growth hormone. But if that's not working, you could always do an add-on donor program we have for very good pricing. But consider your eggs first, always. And let's see, Mara, what would you do differently with an AMH of 18? We talked a little bit about that. Really, it's keto, ovacitol, maybe add that and the metformin, and then think about the ovarian drilling. And sometimes it takes longer Clomid or letrozole, and it takes a low and slow dose of gonadotropins in the process. Bonnie did the Kiltz's ice cream, 1 pint of cream, 1 egg, 2 tablespoons of real sugar, white, and 2 tablespoons of vanilla, by the way. It's rock solid, and she infused it with a little lavender. And I think if you're looking at some of the essential oils that are edible, make sure they're edible, they may be very healing and healthy for you. And Jessica asked a good question about dairy and inflammation. Well, it's mostly milk that contains all the lactose and all the proteins, but butter and cream is all fat. You got to really source it properly. Grass-fed may be better, and make sure no hormones or antibiotics. And the cream and butter, I don't recommend any yogurt, any milk, any half and half. The ice cream that I use is full cream, a little bit of egg and sugar. You can even add some butter to it, by the way. It's amazing. You got to heat it up a little bit, but it's pretty amazing. And Francis, Neupogen. Well, Neupogen is a growth factor, and we're using it also at times for priming or prepping the uterine lining to make it more accessible to implantation. And we're adding Neupogen along with Prograf, prednisone, intralipids to help with increasing implantation and reducing miscarriage. Most of this inflammation is related to blood clotting, microvascular inflammation, and that's why we use aspirin and Lovenox. They can be very helpful. Humira and Plaquenil can be very helpful, and IVIG is the gold standard. But one of the reasons we work towards more of these simple things, less costly because of the cost of it. But the real home run is going to be utilizing the IVIG if everything, all else fails. And let me not forget about leukocyte immunotransfusion, LIT, at Markham Fertility with Mike Vero in Toronto or in Nogales, Mexico. One of our clients went to Mexico, crossing the border. The guard asked where they're going and relayed LIT, and the guard said, my wife did it and we had a child. So, these things that we've usually thought wouldn't work come to show that they're more helpful than we think. Doc, how you doing? Lining greater than 8.5 to 9, really necessary when doing FET. It's amazing. We're looking for 7.5 to 8 or greater. We're seeing that 14, 15, 16 linings may have as good, and some people might think better. But the problem here comes that we're really evaluating the people who make these linings, not because we're able to make the lining. Those people that have thicker linings maybe have other parameters that make them more fertile in the process. I hope that answers your question. And again, the Neupogen is either given intrauterine wash or a subcutaneous injection, and usually 60 micrograms a day is our dosing. Debbie, how you doing? Doing a new cycle after 2 failed FETs. Add-on cycle donor eggs this time. Make sure I get all this. Well, will the protocol stay the same or be different? And I've got to look at that specifically. And if I haven't gotten back to you, I apologize. But quite often it may be the same, but it may be different. And quite often we're looking for either more natural, a little bit of letrozole, and looking at the immune protocol. But we're doing really nice with our frozens, with a letrozole or natural and a trigger shot, and then timing the transfer. The endometrial receptivity assay, the ERA, and we've been looking to use it in New York, but we can't yet. So make sure you call your local state representative, Department of Health, and tell them we want the ERA in New York so the doctors here can take better care of you. The ERA is a biopsy of the uterine lining after 6 days of progesterone in a mock cycle to see if the lining is lined up where it should be with when that embryo needs to be there. And there's about a 3-hour window plus or minus on that. We are utilizing some Pennsylvania doctors and others around the country. OBGYNs will even do the biopsy and assays for us. So simply ask about it. I'm not pushing it because it's not clear yet that it's the thing. I think endometrial scratch may be the thing that's most important. So I'm talking a little bit more about that. And Debbie, if I haven't gotten back to you, please let me know and I'll get back to you. It's been a crazy week. First IVF. Hi Patrick. It wasn't successful. Acupuncture before and after. Embryo transfer. Also intralipids. The wash. Prednisone. Monday and should have our second IVF. Consider if you didn't do the freeze-all, didn't do the scratch, let's make sure we add those on. I quite often will up the prednisone and the Lovenox in the process. Make sure you're doing full keto. And if you haven't had the laparoscopy for endo, I recommend it highly. Some of our doctors all have a little different opinions, but that's the nature of us doctors. But when all else fails and you're putting already so much emotions and physical and financial investment in this, you should know all the possibilities. And I don't believe we're really able to pinpoint the thing, so quite often we utilize the blanket approach in all of this. So I hope I've answered your questions there. Sharonda, 78 pounds on keto, down, awesome. A life changer. And we're seeing life changers. Our life changers, you get pregnant naturally, but you feel healthy and well in so much of your life. Well, is there any water in that bottle right there? I just need a little swig of something to clear my throat a little bit. What tests, back to Sharonda, sorry about that, when I start our cycle and just an ultrasound and check follicles? Well, the baseline blood work, thyroid function, make sure you had a vitamin D check, make sure the sperm's good, the uterine cavity is good, and tubes, that's good to check if you don't know what they are already. But really, there's minimal testing necessary. We do recommend genetic testing for everyone because you got to know it, because I can't know whether or not you have or carry a genetic disorder. It's not likely, but it's not impossible. So it's something that you should think about. Jason, we'll check it out on recipes, and we'll look at that. So we'll send it out. Oh, thanks. Will's got me another swig of a little Saratoga. Thank you. Hang on one second. Mandy, MTHFR, supplementation for frozen embryo transfer. So, this MTHFR is a little bit of a controversial area. Basically, homocysteine levels, check them. If they're normal, it's not likely a problem. But if you're heterozygous and have a mutation, then treating with a anticoagulant, a blood thinner, may help with implantation. The problem is it's just controversial. I look at it. And supplements for frozens, well, make sure that vitamin D, you're taking your prenatal vitamins. We recommend the Ovavite through Theralogics. It has all of those that you need, including the CoQ10, fish oil, and folic acid, and then the Ovasitol, real important, because I believe all of us have a metabolic disorder, and the Ovasitol really, really, really helps tremendously. And Jennifer, Lappin on birth control pill, take longer to stim for an IUI cycle. It may take a little bit. The birth control pill for some people may suppress and slow them down. The laparoscopy, I think, helps. If you want a little higher dose, I always say when that IUI isn't working, bump the dose up maybe 50 to 100 units. Be a little more aggressive, but if you're making more than 3 to 4 eggs, do an add-on cycle to IVF. Still do the IUI, retrieve some of the eggs to diminish the number of eggs that are potentially being ovulated, and I think that'll help tremendously. How are we doing with time, Will?
8:57.
All right, hope everyone's doing well. Really appreciate the connection. Share it around the globe. The more we learn that comes our way, the better for all of us. We're really firm to affordability. We have payment plans, 3 years. I'm pushing out to 5 if needed. We don't do any credit checks. We're here that we're all working to help everyone here. Affordability, donate meds, donate other things. It's about helping build families. Really, really important for all of us. Hey, Sonia, it's really a pleasure. And Kathy Williams, thanks very much. Let's see, laparoscopy have to be done before stimulation. Laparoscopy doesn't have to be done at all, but if you do it before stimulation with the hysteroscopy, it may help improve your outcome. So what we want to do is we want to stack all the processes in your favor, right? So start simple, but when simple isn't working, add a little bit more in your favor. Remember, that's what you want. Jasmine, how you doing? Blighted ovum. Is there no idea as to what causes this? I just had a miscarriage after IVF, blighted ovum, and frightened of it happening again, and I can understand that. And thank you for the encouragement and support. I believe a blighted ovum is just another failed implantation, either from a bad egg, bad sperm, bad embryo, or a bad implantation site. Everyone thinks that it means it's more likely to be chromosomally abnormal. Well, that's not necessarily true. And plus, the placenta may be chromosomally abnormal, but the fetus may be normal. I really think we need to look more and more towards inflammation in the uterus. 30 days of an antibiotic. Look at a uterine biopsy to look for that if necessary. But a 30-day, we've seen people do an HSG, do antibiotics for 30 days, and then voila, get pregnant. And keto really helps a lot. But I think the blighted ovum, and this is hard. Talk to us. Talk to someone. Share the story. Blog it. Write it down. It really helps to get through the pain of the process, to break out, see the light, and be pulled, to be encouraged. And I think our job is not to be downers and discouragers, but to be hope dealers. And we're merchants of hope, and have only positive energy. Continue to be hopeful. Put pictures of you and babies, your family, and really don't give up. Bonnie, really good questions. Thank you. Infrared saunas. Keep the temperature low. Infrared, red light, really helpful. We've been working with Jennifer Waters at CNY, our next door to our CNY Healing Arts, 191 Intrepid Lane. She's wonderful. And I think they can be very, very, very helpful. Sunlight, light, it's really critical for our bodies. Get out into nature, but slow it down. Hey, Justine, how you doing? Ashley, thank you. Let's see, is there a difference in success rates for doing frozen transfer of the cycle immediately after retrieval or waiting an extra cycle? Well, don't really know that answer, but if it takes another month or 2 or 3 to prepare your body and prime it better with keto, LDN, hysteroscopy, D&C, I think that's real important to do. It may be worth waiting an extra month. Quite often, we'll do a retrieval, either do a hysteroscopy, D&C, or an endometrial biopsy in preparation for that next embryo transfer. So I think it really depends on timing, travel, and all sorts of other things. But fresh transfers still work. If your progesterone is less than 1.5 and your body's otherwise prepared, and our job, remember, I'm not here to force any ideas on anyone. I'm trying to sprinkle the fields here with new and different ideas. I'm just creating a menu. I'm the Ferrari mechanic and you're the Ferrari. Valuable, expensive, irreplaceable. Let's begin to treat our bodies like the valuable entities they are. Be careful for all that food marketing. The supermarkets are telling us things are good for us, and they're not. And so we take it hook, line, and sinker, and we go right down to the bottom of the bucket. And remember, the pelvis is in the bottom of the bucket, and the belly and the bowels, and they get trashed with all the inflammation. So, any other things that I should add here, Will? We good? I think we're going to see you next month. Valentine's Day, spend time with yourself, your partner, your family, and really, we can't lose faith. Hold on to it. God bless. And keep sharing. This is Dr. Rob Kiltz. See My Fertility. Just share your stories on and on. Bye.